German excellency in medicine is well known throughout the world. So whenever you have a problem and you need a good surgeon, then you come to Germany.
German healthcare is considered one of the best in Europe and around the world.
We are the only hospital in Bahrain using such techniques.
This hospital brings this German excellency to Bahrain.
In the USA, the medical costs are very expensive. In the UK, Canada and Australia, the waiting lists are exceptionally long. And in third world countries, they don't have the advanced techniques.
Many patients from the Middle East that want excellent health care and fly to Germany for their care.
After this short-term treatment in Europe, normally the whole treatment is not finished. Think about after an operation, the patient needs to have a continuous contact with his surgeon.
Dr. Heinz's vision was to bring the same quality closer to the patients and on a permanent basis, not with visiting doctors. So we are here before the surgery, during the surgery and after the surgery.
If the patient enters the clinic, he will find a very nice atmosphere as well. I think what's unique about the German Orthopedic Hospital is that everything happens under one roof, starting from pre-op check, surgery, post-op check and as well physiotherapy. Everything happens on one single floor.
The main focus for the German Orthopedic Hospital is three things. This is patient safety, the quality of care and also patient comfort.
First of all, every treatment is starting with a diagnostic.
The assessment here is very thorough, so the patients will come in and the doctor would do an initial assessment.
Regardless if it's an outpatient or an inpatient, examination is the most important thing for us.
Surgery is not the answer for every patient. So before we decide to do surgery, we spend time on diagnostics to really find out what is the problem that the patient.
The doctors are very focused on the diagnostics because even if the patient is coming with knee pain, it could be not just the knee pain, it could be the pain from the back.
We are not doing any surgery until it's really necessary. So if, for example, physiotherapy or medication is doing the trick, then we will go for that option first.
From the beginning, our idea was to bring best quality in equipment, and we ordered most of the equipment from Germany, but also we have world-leading products from other countries.
We use, for example, ultrasound-guided regional anesthesia. Conventionally, electricity was used to find nerves. We use now the ultrasound to see the nerve directly and see also where we inject the local anesthetic. So this reduces complications and also has a much higher success rate than the conventional technique. And I was asked by doctors in Bahrain to train them in this technique because it's not available anywhere else in Bahrain.
The equipments we have here, especially in the operation theater, are even hardly available in Germany. It's a very well set up operation theater.
The standard of the equipment and of the operation theater is so high, I've never seen something like this even in Germany. For example, on the roof, the AC unit only for the operation theater is so big that it's like bigger than all the other AC units for the whole building combined. Yeah, so this is very important for the operation theater because the laminar flow, how you call it, takes away bacteria and pollution from the operation table. So this is what you actually want when you do an operation.
We also are using a cell-saving system during the operation to reduce the blood loss of the patients. I think actually we are the only hospital in Bahrain using such techniques.
I think the quality that we have in the operating theater is very high. We have a dedicated team that is only responsible for sterilization.
My name is Jörg Dorenwind. I'm in charge of the sterile supply of instruments here in the hospital. All our instruments are heat resistant. This allows us to disinfect the instruments with hot water with 93 degrees. After them, we sterilize these instruments also in a pre-vacuum with 134 degrees for 4 minutes. The complete cycle is around 3 hours.
We also monitor our patients during the operation and even after the operation very closely, electronically, so that there can't be any failure, any human failure at least, and that we are always 100% sure that we know how the patient is feeling, because we monitor the blood pressure, we monitor the pulse and the oxygen saturation.
But the equipment is not the only thing, because equipment alone doesn't make good medicine. It is the team itself using the equipment which is making the quality.
One of our big advantages is the team approach that we have. Because we're working all close together, it's always possible to ask for somebody else's opinion and to get help from one of the colleagues.
Let us start with Dr. Rubens. Dr. Rubens is one of the most experienced spine surgeons in Germany.
Dr. Rubens is a very well-known, highly experienced spine surgeon. I remember one case, this was the Minister of Finance. He was also operated in his department.
I know Dr. Rubens is a great big surgeon, a spine surgeon. He's very focused on his patients, even after duty for 24/7.
Dr. Rubens is very thoughtful and gentle, and he really is truly dedicated to his work.
In Germany, I think they have a huge waiting list if they can attend a surgery with Dr. Rubens.
Yeah, Dr. Heinz is one of the leading orthopedic surgeons within Europe.
Dr. Heinz is a very known orthopedic surgeon in Germany, and he develops his method for the hip surgery, and he's a very specialized doctor to treat orthopedic deformities.
Of course, Dr. Heinz actually is the reason why I came here.
He invented his own techniques, which is a minimal invasive technique for hip and knee replacements, which have been studied by other surgeons as well all over the world.
So Dr. Heinz is very well known all over Germany, especially when it comes to knee and hip implants. He has a lot of publications done, and a lot of publications are done over his approach to the hip replacement, for example.
Dr. Heiner are a very specialized anesthesiologist with many years experience in the little or endoscopic assisted operation, and he gives us a very comfortable situation to do our operation.
He is, let me call something like a cool guy. Even if it gets difficult, he doesn't get nervous, and he is really one of our basics here to work.
He's the only one who does ultrasound guided reachable anesthesia in Bahrain, and it's the latest thing.
He's very good and very gentle with patients, so he has a lot of understanding for the fears when somebody gets narcosis and it's maybe for the first time, so he really knows how to deal with those patients.
There is Dr. Mike. Dr. Mike, he is a young doctor, he is very talented, and I think I don't need to tell you more than he made an operation with my own son. I trust in him.
Dr. Mike is the youngest member of our team, but he has an acute eye for detail. He uses remarkable techniques and he truly is a great surgeon.
Dr. Mike is our youngest doctor. He's an amazing talent. And he is specialized for keyhole surgeries, like arthroscopy for the knee, for the shoulder, and specialized in sport medicine.
Dr. Marcus, we selected here to come because he's a pain specialist.
He knows alternative forms to treat pain, for example with ear acupuncture or with homeopathy.
Dr. Marcus, he is a consultant anesthetist and he has a subspecialty in chronic pain therapy. So the patients that have chronic pain, he can use alternative modalities of treatment, medication, there is electrostimulation, there is acupuncture that he is using.
So when a patient comes to us, they have an umbrella of doctors, and the assessment is done and then the best doctor is targeted for that patient. But it's not limited to that. So if the problem changes or is different, they can see another doctor. All the doctors consult within each other to come up with the best treatment for the patient.
The team is perfect. Actually, I've never worked with such a great team than this one here before. Everybody is a team player, so nobody is just going to treat some patient on his own. We always discuss cases, and if anyone has a problem, then he consults other doctors. So we really make sure that the patient does not only get one doctor opinion, he gets at least 2 or 3 opinions. So that's all to make sure that he gets really the best treatment that's possible.
In average hospitals, even in Germany, their patients are not operated on by the most senior staff member, usually by junior staff or trainees. So in our hospital this is different, we don't have any junior staff. All of our doctors are highly experienced consultants, so this is a benefit for the patient in terms of quality and safety.
And I'm very proud to have this combination between best equipment and high qualified team.
As an example, in a conventional hospital, patients after hip surgery, they lie 2 days in bed and then only after 2 days they start slowly mobilizing and they have to stay more than 2 weeks in the hospital. In our hospitals, the patients, they have to get up on the same day. The next day they will start walking and 5 days after the surgery they will leave the hospital walking.
One of our main focus is to make all as good as possible pain-free. So the memory of the patient after the treatment or even after an operation is never connected with pain.
The vision is to provide professional German orthopedic medicine so that the people here, let's talk about Middle East, don't need to travel anymore to Germany. They can stay in the old country. They can be with the families.
We are optimizing healthcare in this region of the world by bringing the German standards to Bahrain.
The goal is to bring the patient back to normal activity of daily lives.
And our understanding is to be a partner and friend to the patient.
I think the patient can really expect the best there is on this planet actually.
The vision of the German Orthopedic Hospital is that the patients are coming with her pain and leave the hospital with a smile.